Welcome to the fascinating world of public health. Public health is all about keeping people healthy and preventing disease. It's about creating conditions where everyone has a fair chance to thrive. This field uses many frameworks and tools to understand and address the complex factors that affect our well-being. In this essay, we'll explore some key concepts in public health. We'll delve into the ecological perspective, a framework that helps us understand how different aspects of our lives and surroundings influence our health. We'll also examine the core functions of public health, the essential services it provides, and how health trends have evolved over time. Let's begin our journey into understanding public health and its impact on our lives. Imagine a pebble dropped into a pond. The ripples spread outward, affecting the entire pond. That's how the ecological model views health. It shows how different factors influence each other to shape our well-being. These factors exist at multiple levels. First, the individual level includes our knowledge, attitudes, and behaviors. For example, whether someone smokes cigarettes or exercises regularly falls under this level. Next, the interpersonal level focuses on relationships with family, friends, and peers. Social support and social networks play a significant role at this level. Then, the organizational level encompasses our workplaces, schools, and other institutions. These settings can promote health through policies and programs. At the community level, we look at the broader community and its resources, such as access to healthy food, safe parks, and quality healthcare. Finally, the policy level involves laws, regulations, and policies that can impact health, such as those related to smoking, seatbelt use, or access to healthcare. The ecological model highlights that our health is not just determined by our choices, but also by the environments we live in and the systems that surround us. Public health is proactive. It focuses on preventing problems before they start. To achieve this, it relies on three core functions. First, assessment involves monitoring health trends, identifying health problems, and evaluating the effectiveness of interventions. It's like taking the pulse of a community's health. Second, policy development focuses on creating and advocating for policies and strategies that promote health. This could include things like smoke-free laws or vaccination campaigns. Third, assurance ensures that essential health services are available and accessible to everyone. This includes things like access to clean water, safe food, and quality healthcare. These core functions are put into practice through 10 essential public health services. These services work together to protect and improve community health. Public health often takes a systems perspective. This means looking at the bigger picture and understanding how different parts are interconnected. Imagine a car engine. It has many components that must work together for the car to run. Similarly, public health views health as a system with interconnected parts. The mission is the overall goal or purpose of the system. In public health, the mission is to improve and protect the health of populations. Structure refers to the organization and components of the system, such as healthcare providers, government agencies, and community organizations. Process describes how the system operates and how different parts interact. Outcomes are the results or effects of the system's activities. In public health, outcomes might include changes in health behaviors, disease rates, or life expectancy. By understanding how different parts of the system interact, public health professionals can develop more effective interventions and policies. Over the past century, the leading causes of death in the United States have shifted dramatically. In the early 1900s, infectious diseases like tuberculosis, pneumonia, and influenza were the biggest killers. Thanks to advances in sanitation, vaccination, and antibiotics, these diseases are no longer as deadly. Today, chronic diseases such as heart disease, cancer, stroke, and diabetes are the leading causes of death. This shift highlights the importance of addressing lifestyle factors, such as diet, exercise, and smoking, to prevent chronic diseases. While, overall health has improved significantly in the United States over the past century, these improvements have not been distributed equally. Some groups of people experience greater health challenges than others. This is due to a complex interplay of factors, including socioeconomic status. People with lower incomes and less education tend to have poorer health outcomes. Race and ethnicity also play a role, since health disparities exist among different racial and ethnic groups, with some groups experiencing higher rates of certain diseases. Geographic location matters too, because where people live can influence their health, as rural areas may have limited access to healthcare and urban areas may face challenges with air quality or crime. These disparities highlight the need for public health efforts to focus on reducing health inequities and ensuring that everyone has the opportunity to achieve good health. For a long time, health was simply defined as the absence of disease. However, the World Health Organization, or WHO, defines health more broadly as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition recognizes that health is multidimensional and encompasses not just physical health, but also mental, social, and emotional well-being. Public health professionals use various indicators to measure the health of populations. One commonly used measure is life expectancy, which represents the average number of years a person is expected to live. Another important measure is infant mortality rate, which reflects the number of infant deaths per 1,000 live births. However, living a long life is only part of the picture. It's also essential to consider the quality of those years. Measures like healthy life expectancy and years lived with disability provide a more comprehensive view of population health. Our health is influenced by a complex interplay of factors, often referred to as the determinants of health. These determinants can be broadly categorized as behaviors. Our choices and actions such as smoking, diet, and exercise play a significant role in our health. Genetics matter too, since our genes can influence our predisposition to certain diseases. The environment, meaning our physical surroundings like air and water quality, can also impact our health. And of course, medical care. Access to quality healthcare is crucial for preventing and managing health conditions. It's important to note that these determinants don't operate in isolation. They interact and influence each other in complex ways.